Welcome to Bold TV. My topic today is a vital one for women all over the world. Turns out 50 to 80% of women will have fibroids by age 50. No one knows what causes them, except to say genetics does play a role. Symptoms are ones women get used to dismissing. Who hasn't heard a female friend say, "I feel so bloated"? Heavy bleeding during periods is also something women live with, without ever knowing fibroids may be the cause. Traditional treatments have had 20 million women have hysterectomies. Without ever being informed, there are other options. Welcome, Nehal. You're here to tell us otherwise. There are options.
There are definitely options, and I'm very excited to be here with you today, Maria. Thank you for having me.
You're welcome. My pleasure. Tell us, how did you get started? Viva Eve is the name of your practice.
Yes, Viva Eve.
Tell us how you started.
So my husband is an OBGYN, and I'm traditionally a therapist, a psychologist. And a few years back, he wanted to go into private practice, so I kind of put my psychology on the side, and we joined forces to kind of help each other start this practice in OBGYN. And as an OBGYN, he was coming home a lot with this feeling of, I'm taking so many women to the OR to treat fibroids. You know, we're doing hysterectomies where they remove the whole entire uterus, or we're doing myomectomies where they cut the woman open and they kind of, basically cut out the fibroids.
Sure.
And in the cases of the myomectomies, the fibroids in many cases were growing back within 9 months, a year. And he was kind of getting a little distressed with the idea that, constantly taking women back and forth to the OR to do this major surgery that, women were coming back with fibroids again in a matter of months.
Right, repeating.
And so he was, he came home and he was like, I think there has to be a better way. I know there are other options out there. We haven't studied them. Why don't we start looking? And so him and I spent a whole year studying so many options. And we found some that were really good but not FDA approved yet, really good but aren't covered by insurance yet. But the one that we found that stood out to us that has been around for 20 years was the uterine fibroid embolization. And there are doctors who perform it, but it wasn't being performed as often as we'd like. And so we spent a year doing research. We looked into everything, and we were very surprised. I was very surprised. I'm sure he knew, but I was very surprised to find that, the staggering amount of women that are diagnosed, like you said, between 50 and 80% of women will have fibroids by the age of 50, by the time they hit menopause.
Now, let's just pause for a minute. I want to get back to uterine fibroid embolization, the treatment. I don't want to assume that everyone out there knows what fibroids are. Let's first... What is a fibroid?
So a fibroid is usually a non-cancerous tumor, but it can, in rare cases, be cancerous as well. So we always look and check for that as well.
It's a growth.
It's a growth, or we call it a tumor or growth that will kind of grow more commonly within the cavity of the uterus or on the lining of the uterus, the muscle wall of the uterus.
How large can they get?
It can be anywhere from a seed, the size of a seed, to a size of a watermelon. So we've had women...
That is unbelievable to me. So it's incredible to me that there's women walking around, they aren't aware, they think that it's just normal for a woman to have a belly. And that's what I meant in the intro when I said, you always hear women saying, I'm so bloated, or, I don't have a six-pack abs. It's just normal that's a women thing, when it could be from a fibroid.
It really could. And there's so many other symptoms that go along with it that women are kind of almost programmed to think it's normal. It's normal to have very heavy periods. It's normal to bleed 15 days out of the month, when in reality, it's not so normal. Every woman is different, of course, and every woman's flow will be different, of course, but there does come a point where it's not so normal, and you should check and see what that cause is.
I also think that they're actually creating things for heavy blood flow as normalizing it even further.
Yeah, that's true.
It's
bigger pads.
Bigger pads. And it's like, no, go get checked. It is not normal to call in sick to school if you're in college or to work and be in pain once a month. Let's talk about the symptoms.
Sure. So the most common symptoms we see is, like you said, the bloating, the very heavy bleeding, the cramping, really bad cramping during your period, a irregularly long period, something that lasts more than 8 days, bleeding in between periods, for example. Pain during intercourse is a big one, lower back pain, leg pain, constipation, anemia due to loss of blood. A lot of these women are very anemic.
Interesting.
And anemia can cause fatigue. It can cause a lot of different complications. So those are the most common we see, the symptoms that are kind of reported the most when women have fibroids.
Now, does a woman ever go to the doctor and they'll say you're anemic, but not check what's the cause of the anemia?
I'm not sure. That would be a hard one to answer because I'm not sure how every doctor kind of does their workup.
Right.
I know that OBGYNs in general are probably programmed to check for certain things when a woman is anemic. It's usually due to blood loss. So if she's losing a lot of blood, then we'll check and see, well, why is she losing so much blood?
Right.
So I would assume that about OBGYNs. I'm not sure about like general practitioners or anything like that.
So what would find a fibroid? Is it found in a normal pap smear? I think that's important for people to know.
Yeah,
How would
sure.
you, if there's a viewer watching that says, you know what, I have those symptoms.
Yeah.
I want to get checked. What do they do?
So we start with an ultrasound. And an ultrasound can pick up on fibroids, but doesn't always pick up on fibroids. So we start with that as a basic. And then if we have suspicions or we do find fibroids, we like to send out for an MRI. And MRI is what really will show you exactly where the location of the fibroids are, what size they are, and how many you have. That really gives us a complete picture of
An
what's going on.
MRI is the one that you're going through the machine?
Yes. Yeah.
Okay, so it's taking a picture of the entire area,
Yeah.
and you can actually see, or do you actually show the patient the fibroid?
We do. So if you do it with contrast, the fibroids will light up like Christmas lights, kind of. So
Wow.
once you do that and you look at the image with the doctor or with the specialist, it will show you like, look, these are the fibroids. They're lit up in the picture. And it really gives us a very good picture of where they are, the location, because location is very important for treatment as well. And how many they are and how big they are. And that's really what gives us the best picture.
And now yours treatment is non-surgical,
It is non-surgical. So
which I think is, whenever you can do something that's non-surgical, it's the best, actually the best
we love it,
treatment.
yes.
And that's why I'm thrilled to have you on the show. Want to repeat Viva E, V-I-V-A,
Viva, EVE.
EVE is the name of your center, and you have two in Astoria,
We have one in Forest Hills, one in Astoria.
Forest Hills, Queens, Astoria, Queens,
And
and
we
you're
will soon
opening
be-
one on
Yes.
Madison Avenue in Manhattan soon.
Hopefully. We don't know the
Yes.
exact location yet, but we will be in Manhattan within a
York
year,
City.
and we're very excited about
That's
that.
wonderful.
Yeah.
And you do get people from out of state as well.
We
It's not
do.
just New York City.
We do. We really do. We get people from New Jersey, Pennsylvania. We do get a lot
Mm-hmm.
of people from out of state who come to us because either they don't have that option around them close enough, or they've just communicated with us, they trust us, they want to come in,
Mm-hmm.
so they'd rather, travel that way and come. So we do.
Well, I think one of the things that sets you apart, your husband's an OBGYN.
Yeah.
You're a psychologist,
Yeah.
and I think your being a psychologist gives you that compassionate, empathic nature with patients.
Yes.
And tell patients about when they come in that it's not just a normal clinic. I love
So
that
it's
you made
true.
it like a
Yeah.
very warm environment where people feel like they're at a spa.
Yes, we did. We really worked very hard when we were setting up our practice. We worked very hard. We understand that it's, especially going to an OBGYN is not the most comfortable nor the most
No,
fun
it's
activity
cold.
to
It's
do.
clinical and
Exactly.
cold.
It's uncomfortable physically. And it's,
Absolutely.
So we worked really hard to create a space and to continuously, as we grow, always create spaces that are very, very warm and very inviting and very comfortable and safe. And even the way we deal with our patients is very different than what you would generally see. We're very patient-centric. We try very hard to make their life a lot easier rather than a lot harder, whether it comes to finances or whether it comes to how they feel. And I think the environment you're in, we start with the environment, but we also really are very careful who we add to our team so that we add people that are warm, people that are, helpful, empathetic, people who give. Even our staff is so multicultural, and I do that on purpose so that if you're from a certain culture, a certain background, and you come in, it's not predominantly, you're not stepping into a predominantly,
Right.
one culture or another.
Diverse. And I've called your
Exactly.
office, and it's absolutely true.
I'm
It's such a
glad.
warm environment,
glad.
and I love that. And I actually think, like this month, I was reading on the way over here, it's National Cervical Cancer Awareness Month.
Yeah.
Women are not getting their pap smears. And I think it's because it's a cold, clinical, uncomfortable,
Yeah.
nobody looks forward to it.
It's true.
And cervical cancer can be prevented.
It's true.
And when you create a warm spa-like environment where people are coming in, they actually look forward to the appointment.
Yeah.
It will help with that prevention.
Very true.
And with
It
finding
encourages
things
them to
like
come in.
fibroids
Very true.
as well.
Very
And you speak from personal experience.
Yes, so it's very ironic.
That's
but,
the other thing that makes
yeah.
you so compassionate. So tell us
Yes.
about that.
So about a year into starting this fibroid practice, my husband and I had started together. I started having symptoms that I was not used to having at all. I started almost, I want to call it like hemorrhaging and, just bleeding profusely a lot. And I had never had that.
Yes.
I didn't pick up on the fact that it could be fibroids at all. I don't know why. My husband, of course, the minute I told him, he said, let's get you tested, go get an MRI. So I
Right.
did all that, and it turns out I had 2 fibroids.
Wow.
They weren't very large, and they sometimes tell you size doesn't matter as much as location. So the location of your fibroid is more key to the symptoms you'll have than the size of the fibroid in many cases.
Why is that?
Because if the fibroid is in the cavity of the uterus, it can cause you symptoms that it won't cause if it's in the wall of the uterus. So the heavy bleeding, or your body kind of has a foreign object now in the uterus that thinks it's pregnant. So you would have a much harder time getting pregnant if the fibroid is in the cavity of the uterus.
I imagine that takes a lot of energy, all that blood feeding into...
Blood increases,
Yes.
the blood flow increases to the uterus now because it's feeding this fibroid.
Right.
So I went and did the testing. I found out I had fibroids, and I thought, how lucky am I that we started and found this other option that's non-surgical that I can do.
Right.
Because I don't know what I would have done if my only options were surgical. I don't know that I would have treated it right away. And many women have told us they've had this for 10 years, and because the only option given to them was surgical, they have held off.
Yes,
So
I hear that a lot as
it's
well.
very true. So I was very lucky that we had started this. So I decided what a great way for me to also be the patient and see firsthand, what do our patients go through? What do we put them through? We say we're really good at this. We say we're very warm,
Yes.
but what is the actual, experience?
It was almost meant for you to go through that.
It was, and I went through it, and we did make a few changes after I went through the procedure. I gave feedback, and I said, this isn't very clear as a patient. The instructions on the medication you give afterwards, we had to tweak and make a bit of changes, but it was fantastic that I went through that and got to kind of pick up on those things.
That's amazing.
But it also gave me such an insight. You meet people and you try to empathize, and you're like, oh, I'm so sorry, that must be hard.
Right.
But you don't really feel it. And once I went through it for a few months, and I knew, it became much easier to really empathize with these women, say, I know what you're going through, and I understand it. So it helped a lot.
Because you went through it yourself.
yeah.
How did you feel after the procedure?
I felt wonderful. For me, it took me 5 days to recover. So
And to be clear, you had the non-surgical...
I had the uterine fibroid embolization.
Uterine fibroid embolization is what it's
Exactly.
called, and that's what you specialize in.
So
and
we
you had
actually-
it.
I did.
Okay, how did you feel
So
afterwards?
just to correct something, we actually specialize in treating fibroids anyway. So if a woman
Right.
comes to us with fibroids, we will do the hysterectomy, myomectomy, the UFE, depending on what's best for her and what she chooses. So we spend a lot of time educating women and giving
Right.
them all the
Options.
options and telling them, here are all the options. What would you like to do? And it really ultimately, barring any safety thing to the woman's health, it should really be their choice what they decide to go with.
Right.
We're very big on that. So we really help women advocate for themselves. We educate them on all their options. Because if you're making a decision based on 2 out of 3 options you were given, you're not making a real decision. You don't have all the information.
Now, what I thought was interesting was with the non-surgical, you went through the wrist.
I did.
Tell me about that, because I find that
very
fascinating.
interesting. It
There's
is.
absolutely no
Nothing.
scarring. You went through
The artery in the wrist.
your wrist, and you experienced it yourself. So describe that to us.
So there are 2 ways to do the embolization. You can go through the artery that's in the wrist or the artery that's in the groin.
Okay.
So many people assume, why would you even go through the wrist? It's so much further from the uterus. In fact, it's a tiny bit easier because you're kind of, once you get up here and you're going down,
Right.
you're moving with the flow of everything.
Are you
Whereas
asleep?
You are.
Twilight?
You are. It's not exactly. It's not full anesthesia. So
Right.
you won't remember anything. You don't feel any pain, but you're not fully under anesthesia, which
And you
is
said it
nice.
was like a mosquito bite.
It
no
looked,
scar.
afterwards, it looked like a mosquito bite. It was a red bump.
Do you have a see?
Nothing. There's nothing there.
There's nothing there.
Nothing there.
That is absolutely incredible.
So I wasn't cut open. There was a tiny incision that was made. They went in with a catheter. And what they do basically is they try to find the arteries in your uterus that are feeding the fibroid blood.
Right.
And they try to partially block it with like little particles that look like sand. They're FDA approved. They've been
Right.
used in hundreds and thousands of surgeries for heart. So they've been around for years. They don't cause any harm. But once you block that fibroid, the blood going to the fibroid with the artery, that fibroid can't survive anymore if it's not getting any blood.
And that can be done with any size, even if you have the
Any
basketball size?
Even if you have that, and it was actually, UFE was created 20 years ago, around 20 years ago, to treat fibroids that were very large so they could get smaller and they could actually do a surgery safely without bleeding out. But they discovered in doing so that a lot of times they took care of the problem without even having to do surgery.
Amazing.
So it was very, very interesting.
So I already know, I'll ask you again, what makes Viva Eve different than other clinics, but I mean, I can already tell what makes it
I
different.
think what makes us different also is that we do really treat fibroids. We don't say, hey, if you come to us, there's one way to do it.
Right.
There's 100 ways to do it. And we will work with you to figure out what way is best for you, healthiest for you, and what you want. A lot of women come to us, and after all the options, they say, I still want a hysterectomy. I'm comfortable with that decision because she made that decision based on all the facts.
Do fibroids cause infertility? I know the Mayo Clinic recently, it was actually published in 2017, but they were dispelling some myths surrounding fibroids. And one of the questions is, does it cause infertility?
So I don't want to say it causes infertility. That's a very strong word, and I'm not a doctor myself. But I know that it can make it very challenging for women to get pregnant. So if your fibroids are in your uterus,
Sure.
you can have a lot of miscarriages.
Makes sense.
You can have a hard time getting pregnant. Doesn't mean you're infertile. It just means that because you have that fibroid, you're not able to get pregnant. Once you get pregnant, if you are lucky enough to, you might lose the baby.
Right.
So that does happen a lot.
And again, there's no known cause. So there's a genetic.
The best we can say is genetics, and it hits a certain group of women much more than others. It does tend to run in families. African American women are the most that are affected by fibroids. We're not sure why.
That's same with cervical cancer. It's just amazing.
We don't know why.
African American women get the short end of the stick when it comes
not
to
sure why.
medical
So
services.
There's been a lot of could it be products they use in their hair? Could it be hormones in food?
Wow.
We don't have any proof of any of those yet, but
Sure.
we do know that we do see that it runs in families. It does tend to have a genetic and hormonal component, both.
And there's a woman in my Twitter, I had promoted your segment was coming up, and she said that her fibroid burst. And it was the first I heard of something bursting, and
Yes.
I wanted to ask you about that.
I won't speak
What is
to that
that?
because I've never heard of that and I'm not
Yeah.
sure. Again, not being a medical doctor myself, I don't want to answer to something.
So you
I'm not-
haven't heard of
I haven't heard
a
of one.
fibroid
No.
bursting?
I've heard of them falling into the cavity. If they're in the cavity and they're attached, sometimes they fall. We're very mindful of that at
What
VVE.
happens when it falls into
It can
the cavity?
cause, if you're not aware of it and you don't treat it and remove the fibroid, it can block everything and can cause an infection over time, and it can
Oh,
be
wow.
dangerous.
Okay.
So we're very mindful that if we ever do the UFE procedure on someone or any surgery, or we treat anyone for fibroids, we have them come in regularly for checkups to make sure that a fibroid that was in the uterus hasn't fallen. If it does, we remove it right away and we take care of that problem.
Right.
Yeah.
Is there anything else you want to add? I love what you're doing, and I'm so happy that a service like Viva Eve exists for women, because, like I said in the beginning, a lot of women, these symptoms get dismissed, and they're not even aware. So
It's very true.
Again, coming in to see you, getting an ultrasound,
Getting an MRI.
getting an MRI.
Getting all your questions answered. I think we do
Right.
that very well. We don't rush our patients. We will spend, 30 to 45 minutes with each patient, answer all questions. It's important for us, for everybody, to feel like they don't have any unanswered questions when they leave, and that they understand fully what their options are. And we are really big on empowering and educating women about their bodies and their options and what, is happening and why. And just really taking care of people. We don't do the procedure and then let you go. We do the procedure, we follow up with you the day after, a week after, a month after, to make sure, hey, how was the aftermath? How are you feeling now?
Right.
Is there anything else we need to fix?
Yes.
It's not a sure thing. Nothing is a sure thing. So there are times where you treat fibroids with the UFE and new ones come back in a few years. In many cases it doesn't, but sometimes that happens.
Right.
But we will work through it together, and we take the journey together, and I think that's really important.
Thank you. And you went through the journey yourself. And I
did.
think that's why it makes
And I would
you,
do it again if I had to. So
it makes you a better practitioner.
And a better
because
advocate
you
for
are-
it, I
Yes, and a
think.
and a better advocate
Yeah.
for women. So thank you. Thank
No,
you
thank
so
you
much.
so much.
And we thank Nehal for joining us. And women, write this down. Viva Eve, V-I-V-A, eve.com. Stay informed and be proactive and bold about your own health. If you have any questions, write them in the comments, and we'll make sure that Nehal receives them. See you next time. Thank you.